Our group is going over the implementation of an imminent death flow sheet in Epic.
And I'm Claire Brand.
I am Lauren Highfill.
Hannah Otsubo.
I'm Amanda Pouch.
So our PICO question, P is the actively dying patient in any given setting. I is implementation of an imminent death signs and symptoms flow sheet in the Epic documentation system against current practice, which is scattered assessment flow sheets and inconsistent documentation. And then the outcomes that we want to measure is prompt identification of patient changes, increase in nurse and provider communication, increase in family satisfaction, and increase in nurse confidence in documenting signs and symptoms of imminent death in patients.
We chose this topic because there's a need for more end-of-life knowledge in the healthcare field, and we're faced with patient death every day, and we just need to be able to accurately chart imminent death signs and symptoms and interventions and be able to conversate with families. The first study was a survey sent out to internal medicine doctors and hospice RNs in an urban county in the Southeast United States. The survey included questions that focused on the level of control that hospice affords dying patients, healthcare professionals' education and communication involving the dying process, the hospice referral process, characteristics of a good death, and gender versus professional role regarding hospice attitudes. The results showed that there is a difference in attitudes, or the attitudes was greater by profession, physician versus nurse, than gender, and there is a need for more professional education and emphasis on end-of-life issues. The limitations were that there was a low response from the doctors, and then it was only sent to internal medicine doctors, so it can't accurately represent the attitudes of the intended respondents.
My article was focused out of Taiwan. It surveyed several nurses from 3 different teaching hospitals. It was a cross-sectional survey, and the questions included measurements of spiritual health, spiritual care and their attitude towards it, their professional commitment, and then caring behaviors that they have in their practice. So some of the results were that the better the spiritual health of the nurse was, the better care that they provide toward their patients, and the more positive result and relationship they have with their patients in the dying process. Some of the limitations include that the hospital was all teaching hospitals with diverse backgrounds, and all of the nurses that completed the surveys were female, so it could cause poor validity because of the diverse religious backgrounds.
My article was a article that involved 10 hospice and palliative care nurses that participated in face-to-face interviews with a questionnaire. There was 5 rural and 5 urban nurses. The variables that were looked at were nurses' experiences with caring for the dying patient, communication strategies, and approach to end-of-life care and decision-making with families. The results were nurses recognized the imminence of death, creating an urgency to address the patient and the family. The nurse and patient influence each other's communication. It's not just a one-way communication. And poor communication between healthcare providers and family members caused distress and increased level of dissatisfaction. A limitation to this article was that it only included 10 nurses, and it was just done at one healthcare facility.
Was completed in Australia in a regional hospital as a quality improvement project. A care bundle for the dying patient was implemented on 2 medical wards. The aim of the study was to examine whether or not the quality initiative had any effect on the ward nurses' attitudes and self-assessed competency to the care for the dying patient. They utilized a pre and post survey using self-administered questionnaires. They were given to nursing staff who voluntarily completed these before and after implementation of the Caring for the Dying Patient Bundle. Over the 6 months, 74.5% of the people who died did so with the bundle in place, and while this was not seen as clinically useful by nearly half the nurses who responded, there was not a significant change in the staff's attitude or self-assessed competency. Therefore, the limitation of this study is that it was a short time frame of only 6 months, making it impossible to determine long-term effectiveness. So our recommendations would be to create an EPIC flow sheet displaying the imminent signs and symptoms of death for allow for close patient monitoring in order to see the changes as they occur. We essentially would have the 5 options on the right side in EPIC as a drop-down flow sheet where you could select within daily limits or a drop-down toolbar of different signs and symptoms. You can select yes, no, and then an additional drop-down toolbar would appear. Signs and symptoms that we believe would be important to include is respiratory pattern, level of consciousness, modeling, skin temperature, and secretions. This overall would increase family satisfaction and increase the nurse's confidence in documenting signs and symptoms of imminent death. And this concludes our presentation. We look forward to hearing any questions that you all may have.